Did you know that pancreatic cancer, one of the deadliest cancers, often goes unnoticed until it's too late? What if knowing the early warning signs could save your life or the life of someone you love? Pancreatic cancer is a highly aggressive disease that is usually detected in its advanced stages. The pancreas is located deep in the abdomen behind the stomach, is a vital organ responsible for digestion and the regulation of blood sugar. This small but essential gland produces digestive enzymes to help break down food and hormones like insulin, which controls blood sugar levels. Pancreatic cancer begins when abnormal cells grow uncontrollably within the pancreas, forming a tumor that interferes with these functions. Unfortunately, early detection is challenging because symptoms are often vague, subtle, or even non existent until the disease has progressed significantly. This makes treatment more difficult and less effective, leading to less favorable outcomes. Understanding early signs and symptoms is crucial for timely intervention, which could potentially improve the quality of life and increase survival rates. In today's video, we focus on the 10 warning signs of pancreatic cancer that you should not ignore. Recognizing these symptoms early could be the key to detecting the disease before it advances. So, by paying attention to these signs, you can be proactive and seek medical attention if something doesn't feel right. Early intervention can make a significant difference in managing this disease, improving health outcomes, and even increasing life expectancy. So, some of these signs they may surprise you because they are not commonly associated with pancreatic cancer, while others could be symptoms you are already familiar with but may not have known where they were linked to this type of cancer. Number one, jaundice. Jaundice is one of the most visible warning signs and involves the yellowing of the skin and the whites of the eyes occurs due to a buildup of bilirubin, a yellow pigment produced when red blood cells break down normally. The liver processes bilirubin by combining it with bile, which is then expelled from the body through the digestive system. However, when there is an obstruction in the bile ducts or a problem in the liver, as in cases of pancreatic cancer, bilirubin accumulates in the bloodstream, causing jaundice. This symptom is not a disease in itself, but an indication of an underlying health problem that needs immediate attention. Jaundice may also present with other symptoms such as dark urine, pale eyes, and itching, which give doctors more clues about its cause. In adults, jaundice often signals major health problems, especially those involving the liver, bile ducts, or pancreas. Pancreatic cancer, what it does, it blocks the bile ducts, preventing bile from flowing properly, causing these visible symptoms. Number two, unexplained weight loss. Losing weight without making any effort, as through diet or exercise, can be alarming and often indicates a deeper health problem. So, it is important to recognize this when it occurs because it could mean that the body is not getting enough energy from the food, possibly due to an underlying condition such as pancreatic cancer. Weight loss in pancreatic cancer can result from several factors. The tumor can interfere with the ability of the pancreas to produce the enzymes necessary for digestion, leading to poor absorption of nutrients and weight loss. In addition, if the tumor presses against the stomach or other digestive organs, it can create a feeling of satiety, of feeling full, even after eating small amounts of food, which reduces even more food intake. Another factor is that cancers often increase the body's metabolic rate, causing it to burn calories faster than normal. So, if you notice a loss of more than 5% of your body weight within a few months without any particular reason, apparent reason, especially if combined with other symptoms, it is essential to seek medical evaluation urgently. Number three, abdominal pain. Abdominal pain is another symptom that should not be overlooked, especially if it persists or becomes more intense over time. Abdominal pain, it can be very difficult to diagnose. Why? Because this region contains many organs, including the stomach, liver, pancreas, and intestines. In pancreatic cancer, the pain usually begins in the upper abdomen and may radiate to the back. This pain usually intensifies after eating or lying down because the tumor exerts pressure on the surrounding organs or nerves initially. Now, this pain, it may be mild or intermittent, but as it grows or spreads, it becomes more constant and severe. So, although abdominal pain can also be due to less serious conditions such as indigestion or gas, it is essential to consult a doctor. See a doctor if you experience persistent and severe pain, especially if accompanied by other symptoms such as jaundice, unexplained weight loss, or changes in bowel habits. Number four, digestive problems. Digestive problems are common but persistent or severe. Symptoms such as nausea, vomiting, diarrhea, or constipation should be cause for concern. These problems, they affect the gastrointestinal tract and it can range from mild discomfort to serious conditions that affect daily life. It can causes and it can, range from dietary choices or stress to infections or chronic diseases that affect the digestive organs in the pancreatic in your body. So in pancreatic cancer, the body's ability to produce and secrete digestive enzymes is impaired, leading to poor absorption of nutrients. This can cause symptoms such as bloating, discomfort after meals, or fatty deposits known that occurs when fat is not digested properly and is often a sign that the digestive system is not functioning properly. These symptoms not only affect the quality of life, but can also lead to serious nutritional deficiencies and weight loss, further compromising your health. Number five, loss of appetite. A sudden and persistent loss of appetite can be an important warning sign, especially if it leads to weight loss. This can occur for various reasons, including psychological factors such as stress or depression, or physical conditions such as gastrointestinal problems. Now, in pancreatic cancer, tumors can press against the stomach or disrupt the production of digestive enzymes, causing a feeling of fullness or a decreased desire to eat, even after small meals. Sometimes the disease itself or its byproducts can alter the taste, making food less palatable. Loss of appetite is very worrying because it leads to nutritional deficiencies, weight loss, and muscle now weakness. The body's immune response and reduces the overall strength. So that is crucial. Number six, sudden onset of diabetes. The sudden onset of diabetes, especially in adults over 50 who do not have the usual risk factors such as obesity, a family history of diabetes, or a sedentary lifestyle, could be an early sign of pancreatic cancer. The pancreas, it plays a vital role in controlling blood sugar levels through the secretion of insulin, a hormone that helps regulate glucose levels in the bloodstream. Now, if a tumor affects this function either by disrupting insulin production or by damaging the cells that produces blood sugar levels, what it does, it can rise, leading to the sudden development of diabetes. This type of diabetes, it can occur even in people who previously had a normal blood sugar levels. So although not in all cases of new onset of diabetes are related to pancreatic cancer, and sudden onset without typical risk factors, also, this should be a cause for a thorough medical evaluation to rule out pancreatic abnormalities. Remember that early detection of pancreatic cancer through new onset diabetes can be vital, as this symptom often appears before other or more serious symptoms. It is therefore crucial to monitor blood sugar levels and consult with a health professional. Now, if you experience unexpected changes in glucose regulation, especially if you are over 50 years old, please seek the doctor urgently. Number seven, itchy skin. Now, itchy skin, persistent itchy skin, especially when it occurs without visible rashes or skin changes, may indicate underlying problems in the bile ducts or in the liver. Itching is often due to the accumulation of bile salts in the bloodstream. Now, this happens when the bile ducts are blocked, preventing bile from leaving the liver properly. In the case of pancreatic cancer, the tumor can obstruct the bile ducts salts, leading to a buildup of these salts in the body, causing intense itching. This symptom now is often accompanied by jaundice, where the skin and the whites of the eyes turn yellow, further indicating a problem in the biliary system. Unlike regular itching, which may be mild or temporary, itching caused by pancreatic or liver problems. It may tend to be generalized, persistent, and progressive. It can even get worse at night, affecting sleep and significantly affecting the quality of life of the person. With pancreatic cancer, this type of itching may start out subtle but become more intense as the disease progresses. So, if you experience persistent itching along with other symptoms such as jaundice or other changes in the color of the skin, it is crucial to seek medical attention quickly to determine the underlying cause. Number 8, fatigue. Fatigue is one of the most common and often overlooked symptoms of pancreatic cancer. This type of fatigue is one that causes can is extreme fatigue. Now, cancer in itself can consume energy and nutrients, depriving the body of the fuel it needs to function properly. In addition, the disease can cause loss of appetite or digestive problems, which lead to malnutrition and weight loss, which further aggravates fatigue. The emotional stress and anxiety resulting from having a serious illness can also influence, in addition to treatments such as chemotherapy that are commonly used to manage pancreatic cancer can cause severe side effects, including fatigue. This can worsen the already debilitating exhaustion caused by the disease. So, if you experience persistent fatigue that does not improve with rest and is accompanied by other symptoms such as weight loss, changes in appetite, or abdominal pain, it is important to consult a health professional for a more detailed evaluation. Number 9, blood clots. Blood clots are known as thrombosis and can form when blood pro- pro- pools in the veins or arteries without injury, although blood clots are often the body's natural response to prevent bleeding. Blood clots that form spontaneously or do not dissolve naturally can cause serious health problems. For example, they can block veins causing deep vein thrombosis, DVT, or travel to the lungs causing a life-threatening pulmonary embolism. Pancreatic cancer. It significantly increases the risk of blood clots because cancer cells can release substances that promote clotting. That is why some people with pancreatic cancer can develop clots even without an apparent cause. Symptoms of pancreatic cancer include swelling, redness, and pain in one of the limbs. The legs, if a clot travels to the lungs, it can cause sudden shortness of breath, chest pain, or even collapse. This situation is a medical emergency and requires immediate attention. If you notice these symptoms, especially if they occur along with other symptoms of pancreatic cancer, such as jaundice or weight loss, it is important to seek medical attention immediately. Number 10, changes in the color of your urine. Now, this can offer many clues about your health. Under normal conditions, your urine are brown due to bile, a digestive fluid produced in the liver, and urine varies from pale yellow to deep amber depending on hydration levels. However, significant deviations from these colors may be signs of a serious health problem. For example, clear or clay colored may indicate a blockage in the bile duct, which can happen when a tumor presses on or blocks the ducts. This obstruction prevents bile from being released in the intestines, resulting in stools that appear usually pale. Similarly, dark urine can indicate dehydration, but if it persists despite adequate hydration, it can signal an obstruction in the intestines. the bile duct, or a liver problem possibly related to pancreatic cancer. Now, in pancreatic cancer, a tumor that blocks the bile duct can significantly affect both the color of the stool and the urine. This obstruction can lead to fatty stools, which are greasy and foul-smelling stools, indicating fats are not being absorbed properly due to a lack of digestive enzymes. Monitoring these changes is crucial as they can be an early indicators of problems in the pancreas. So if you experience any change of color in your stool or urine, combined with other symptoms like jaundice, abdominal pain, please seek your healthcare professional early. This is of crucial importance. Remember, your body communicates through symptoms, and paying attention to these signals can make a substantial difference in the results. Delaying the medical consultation can allow the disease to progress to more advanced stages where treatment becomes more complicated and less effective. So, prioritizing your health means taking action, getting regular checkups, and consult with your healthcare professional to detect any problems early. So, thank you so much for watching, and don't forget to like, share, and subscribe to the channel to get more health tips. Take good care.